Here to present my process improvement project for Essentials of Process Improvement for spring semester. I am doing my improvement project in regards to callbacks after laser procedures in our spa. So I thought giving a little bit of a background to why I chose this would help everyone understand it a little bit and kind of give um, a backdrops for why I chose to do this. So as you can see in my poster, I have two pictures, one before the procedure, which is me on a daily basis, and then one after the procedure. So the reason that I put these up is so that you can see somewhat of the side effects after one of our laser procedures in the spa. For this, it is the Cutera XLV, which I have listed down at the bottom. It's to treat broken blood vessels in the cheeks and around the nose. I'm a rosacea patient, so I tend to have that symptom, and so I had a laser treatment done. In regards to the treatment, you can see in the after procedure picture that I am swollen. My face has a lot of edema in it around my eyes, in my cheeks, even around my mouth. I did get some edema down below in my chin. Just from the draining of lymphatic fluid. I had a little bit of bruising on my cheeks, and I just didn't look quite like myself. So what happened was I would get calls at work from patients that were kind of freaking out because they were worried that they were having, especially with this laser, an allergic reaction, or they weren't quite aware of some of the side effects from some of our other lasers in the spa and they were concerned. So I realized that patients weren't being educated as well as we could educate them. And it was creating a lot more work for me calling patients back at the end of my day or in the middle of my day. I'm the lead MA in the spa, or I was, and I have a lot of work to do. So it's not just MA work. I order all of our injectables, I maintenance all of our lasers. So it was just one more task added to my busy, hectic day, as well as seeing all of my patients for the day with my provider. So I decided to, I'll read my aim to reduce the number of callbacks directly related to concerns not yet addressed after laser procedures to less than 3 per week by April 1st, 2019. So to start off, what I did was I came up with some measures. I wanted 2 or less callbacks per week as like an outcome, just because that was kind of my goal. I know my aim said less than 3, but 2 or less is the same thing. And I really wanted to get below that too and really only have 1 call a week or none because I thought that would be optimum and that would let me know that my patients were being well taken care of as well. So for my process measure, I did written info over laser patients. So how many laser patients got written info to take home with them in regards to side effects? When measuring all of the laser patients that we had and collecting all the data of how many written info pamphlets went out, it was 86% of our laser patients got a handout with side effects on it. So I'm guessing that the 14% were probably during some busy days where our front desk forgot because they were the ones handing them out as they were checking out, or during events. Sometimes we have patients coming and going, and if they've prepaid for their services, the front desk doesn't always see them on the way out if they just try to sneak out because they're swollen or red. So in that regard, that might be where some of the handouts got lost in transmission. But and then obviously my balancing measure, as you can see on the poster, is for callbacks from patients overwhelmed with too much information. So I thought, what could be a bad part of educating patients that could have kind of a counter effect? And for this project, it'd be over educating. So they were slightly confused because they couldn't remember all of the info that we told them and gave them and all of that on the way once they got home. So for that, I only had 2 calls from patients that were just a little bit, still had some questions because it was a lot all in one sitting and they just wanted to reiterate what I had told them and what I had given them and all of that. So I had a whole team of MAs that work over in the spa here or there with other providers that we educated. My provider is really cool, and she let me educate all of the staff that works in the spa. She's also the owner of the spa, so it helps that she gets to make those big boy decisions. But um, so to do my processes or my change ideas, I wanted to educate the patients first and foremost, let them know what their potential side effects were going to be, because if they know that, especially before a procedure, if you have a big event coming up and you know that you're going to be swollen a day or two later, probably not a good idea to be doing the laser then. So always educating them ahead of time was really helpful. And then obviously educating staff as well, because the staff has to be able to explain these side effects as well as possible. So um, I educated staff. We went through a whole training on at-home care and potential side effects after each type of laser. I made a handout. We had handouts for each individual laser, but I made a handout that incorporated all of them. And so each one of them had their own section and what to look for and what was normal and what was not, what you could use afterwards when you're home. So I did make this handout. I took info from all the handouts we had and made our own just for these types of lasers. And I added those at the bottom of my poster. So Fraxel dual laser, Cutera XLV, which is this picture of me up here. That's what I had done. Clear and Brilliant and Promea lasers are resurfacing lasers, just like the Fraxel. And then Ultherapy is a lifting and tightening laser, kind of like a mini facelift, all with ultrasound, heat, and technology. So when I did the handouts, I also made some visual aids. We have some flyers. They look like little postcards, and they have before and after pictures of some of our staff after each one of these laser treatments. So we always take before and after pictures with staff. So I did that and made sure that the visual aids were presentable to the patients so they could really see true results of what was going to happen afterwards. I made a improvement flow chart. I added that in here. I actually made two, but there wasn't enough room on my poster to include both of them. So I included the ones for callbacks because I really wanted to show that my flow chart had a trend of decreasing and decreasing phone calls. This actually turned out to work very well because I had to drop my full-time position as the spa lead MA just because constraints of school and being a mom of four was a little hectic with my full-time work there because I was there late hours. So because of all my responsibilities. So this helped the new MA that came in that they replaced my position with really have a one-up on not having all those patient callbacks. So that helped her because she was coming into a large amount of work with very little training. So that was one less thing that she had to worry about. I added in on that flow chart about astronomical data because the data point up top because we had our Valentine's Day event that week. And so we had more laser treatments that week, which in turn added to more callbacks, especially with events. It's very hectic. You have patients in and out. You have lots of questions. There's a lot going on. There's specials being thrown at you. There's catered food. There's champagne. So some people are drinking and not listening. So, so that I think incorporated a lot to that elevated number up at the top. But I did get down to my last week was one phone call for the week. So once I hit that two phone call mark, I started reassessing these measures and reassessing what we were doing and kind of giving an overall what could be happening that we can't get down past that too, because we were at it for a couple weeks. What was happening is as I look back, the phone calls that I was getting were about some side effects that aren't normal. A majority of them, probably 80% out of that 6 at that 2 mark were phone calls about something that was going on that was a little bit awkward, like hyperpigmentation or discoloring after lasers. So that was something where a patient just wasn't using the proper samples that I gave them or the at-home care, not because we didn't tell them, but because they thought something else would work better. So it really wasn't showing any, I don't know how to say it, but showing anything that we were doing wrong, or that the measures were not looking at to be able to do this. So I should wrap it up a little bit because I'm at 10 minutes, but I just wanted to let you guys know that we did use PDSA cycles, or I use PDSA cycles. I really wanted to measure. I did a mid-project measurement to see how things were going, assessing. The one thing I didn't do that I had in the beginning with some of our discussion boards was to have a patient survey filled out. We tried it. I did the 1-1-1 test on patients for each of these processes I put into place before we multiplied them each week by 5. So that one survey on their way out was actually taking more time. Patients were concerned or asking questions on why they were filling out a survey. Then they, when I said, oh, I'm doing a project for school, and then they wanted to make sure their pictures weren't going to be involved, and it turned into more of a concern for the patients just for privacy reasons. So I did take that out. And we got rid of that process just because I didn't want to make our patients uncomfortable or aware that we were doing, I was doing something for school and didn't want them having any ill feelings about it. So we just took that out. But just to wrap up, I just wanted to say that this was a really good experience, and we, as a team at my office, worked really well together, and it helped for them to learn how to do some process improvement projects on their own. Not that they know all the ins and outs of it like I do with flow charts and cause and effect diagrams that I made prior to starting this, but they are aware of how change can be made and how it is attainable in a 6-week, 9-week period. So, I think that overall it taught everyone a lesson at my work, and I learned a lot from it. So if you have any questions, please comment on your peer review, and thanks for watching.